moving on to SI joints. So clinical routine for SI joints is a AP. Really similar to that of sacrum, it's just using an increased tube angle, so you're bumping it up to 30 to 35. So if you double it from sacrum, so sacrum's 15 up, just remember SI joints, double it, you're 30 at least to 35 cephalad, and then you're going to do 2 obliques. And I'll show you how to do those in a minute, but rotation wise is 25 to 30 degrees. Don't go too high. Usually that's where people struggle with SI joints. They actually oblique the patient too high and close the SI joint. So I'll show you how to do that, especially in our lab too. Same as AP sacrum, you're going to use that 10 by 12 cassette. Again, central ray is 30 to 35 cephalad per your textbook. So it's double that of your AP sacrum, which was 15. Central ray is 2 inches below the level of ASIS, really similar. And again, just follow pelvis technique. What would you use on the patient's pelvis as far as technical factors go? A nice image here, 30 to 35 up. You can see where it's hitting right at that angle of the sacrum there. What does it look like? So you want your sacrum straight in the middle. You want clear SI joints centered to the image. And the SI joint and L5-S1 junction will be open. Space here. You're going to do 2 posterior obliques. We do both automatically, even if there's only one side of pain. For us, we do bilateral obliques. It's an 8 by 10 cassette. I put mine in lengthwise. Elevate the affected side. So bring the side that you want to do up using, I use that triangle sponge and put right underneath the patient. Centering 1 inch medial to upside ASIS. So find the upside ASIS and 1 inch medial in. Use that sponge to support the patient from hip to shoulder. Make them roll like a log, and I'll show you how to explain to your patients how to do this in our lab. But one of the things people struggle with is if they don't give the patient correct directions as far as rolling, they'll kick their hip out to the side, so then their hips and their shoulders won't be in alignment anymore. So they'll be at this sort of diagonal angle here, and it doesn't work out. So you want the whole body in line and rolled up that 25 to 30 degrees, centering to the upside, 1 inch medial to the ASIS. And this was just a nice image here. So here's ASIS, centering 1 inch in. Your central ray is shooting straight through this SI joint because they sit at this angle in the pelvis. This was a helpful hint. If you stand with your hands at a bit of an angle, a degree of angle pointing at your pelvis, if you rotate yourself into an oblique, you can clearly see this hand, the SI joint would be open, and on this side, the SI joint would be closed. So I'll go back 1 second. Just a reminder, make sure to shoot straight. Once you do that tube angle on the first one, drop it down to 0. I will remind you of that during our lab too. Evaluation criteria, what are we looking for? Well, we're looking for open SI joints. So we're looking for the joint space here. Okay, if it's not open, you're either over or under obliqued, usually. So SI joint space here, looking for an SI joint space here. That's what they're looking for. This was just a CT version of it. Causes for SI joint dysfunction, it could be a traumatic injury, sudden impact, an accident, fall, anything like that. Something basic like arthritis. There can just be wear and tear on the area of pregnancy. SI joints, they can loosen and stretch to accommodate childbirth. I had a really hard time with my pregnancies with SI joint trouble, depending on how my kids were sitting. And then the last one is infection. So it's usually a rare case, but it is possible that it can become infected. And the inflammation of the SI joint is another possibility. They can have pain in their buttocks, their lower back. It can go down their legs, hips to their feet. Not as common, but it can go all the way down their leg, and it's super painful. And then it's possible to be the ankylosing spondylitis. It's a rheumatic disease that causes joint inflammation and stiffness. Anyone can get it, but it's less common and it is often seen in Caucasians. That's just a fun fact for you for the day, but that is going to wrap up SI joints.